You know, sometimes the word obese is thrown around when that's not necessarily the case. But when it is, there are risk factors that one needs to be aware of. To shed light on this topic, Dr. Erica Francois from New Vitality Health and Wellness is back with us. Welcome back.
Thank you. Thank you again for having me.
So, I mean, it's the truth. I feel like obese is sometimes used even as slang these days. I mean, what is it actually to be obese?
So, obesity is a complex, it's actually a disease.
Oh, okay.
It involves having excess body fat. We utilize the body mass index as like the guide to determine if a individual is obese. So if their BMI, their body mass index is greater than 30, they're considered obese. And if it is less than 30, between 25 and 29.99, they're considered overweight. And you know, and in the U.S., there have been some alarming numbers that approximately 40% of our population is considered obese. And so we're trying to work to, change the numbers and change that.
You know, it's interesting you say, of course, it is a disease. Is there a cause to that, or are some people more predispositioned to that? And I mean, obviously, that's then going to have risk factors that we already touched on a little bit.
Right. So the simple answer would be when you eat in excess of calories, you're more likely to become obese. Or if there's a lack of physical activity, you're likely to become obese. However, as you mentioned, there are other factors that play a role. There can be genetic factors, environmental factors that take place, and also other metabolic issues that the individual may have occurred which causes obesity.
Well, and let's talk about, of course, the methods to fight obesity. That's where you come in, and getting to know you and talking about how every person is different. Talk a little bit about what you're able to offer and how you really do stand out among other competitors out there when it comes to helping people get away from the obese category.
Right. So there is no cookie cutter way to fight against obesity. And that's why we offer the consultation for you to come in so we can find out, get lab work done to see what may be your cause. Is it environmental? Is it genetic? And if so, there's our office there. There you will meet our front desk staff, and everyone comes in for their appointment. And you'll see here too, they're weighed. And we also have a 3D body scanner.
So you really have a lot of tools and, of course, the experience.
Yes.
I mean, your credentials alone you've been able to share with me really showed that not only professionally, also personally, you are able to help your patients, aren't you?
Yes, yes. So we offer, there's a 3D body scanner that also gives us over 20 body measurements. It also measures your fat mass, your muscle mass as well.
And I just like seeing the smiles too between you and your patients right there. There's a before and after as well to give people an idea of how you're able to help.
She's done an excellent job. So she comes in on monthly visits. They all do. They come in on monthly visits, and we set goals for them. And it's not always about the number on the scale. That's why we do measurements as well. But we make sure they're eating properly first and foremost, and also exercising.
Well, you know what? You touched on the consultation and how that's such a key important part of the appointment process.
Yes.
And that's really how you can begin. And right now, if people get in touch with you, it's free, isn't it?
It's a free consultation. Yes. And like I mentioned, it's offered either virtual or they can come in person as well. And that's all of our information there. You will find us and give us a call. Yes.
Thank you so much, Dr. Francois. Great to see you again.
Yes, thank you.